Hello, I'm Ben and you're watching The PhD Parent. As I've discussed in another video, you can check out the link below, about 20% of women experience high levels of depressive symptoms during the perinatal period. That is the period that covers pregnancy and about 1 year post-childbirth. In the first part of this video, I'm going to provide an overview of research that's investigated the effectiveness of psychological interventions for perinatal depression. As will be seen, the most common intervention, which has been shown to be effective in reducing depressive symptoms, is cognitive behavior therapy, or CBT. And so in the second part of this video, I'll provide a brief introduction to CBT tailored to depressive symptoms that occur during the perinatal period. If you want a more comprehensive introduction to CBT, you can check out my video in the link below. But first, onto the effectiveness of psychological interventions for perinatal depression. So there have been several meta-analyses investigating the effectiveness of psychological interventions for perinatal depression. And the findings of these meta-analyses have been fairly consistent. So rather than report the results of each meta-analysis, I'm just going to focus on Kuiper's 2023. There are two main reasons for doing so. First, it's the most up-to-date meta-analysis available, and second, the lead author, Pim Kuipers, is well known in psychological circles. He pumps out meta-analyses all the time and is widely regarded as an expert in the approach. So when I see a meta-analysis by Pim, I'm generally confident that it's going to be well executed. So the Kuipers meta-analysis looked at the results of 43 randomized controlled trials, or RCTs. If you want a brief introduction to RCTs, you can check out my video in the link below. Now, these studies involved about 6,300 mums, and in about half the studies, the mums were experiencing depression during pregnancy, and in the other half of studies, the mums were experiencing depression post-birth. In about half the studies, mums met clinical diagnosis for depression, and in the other half of studies, mums reported high levels of depressive symptoms, but were not assessed to determine whether they met diagnosis for depression. Across the 43 RCTs, there were 49 psychological treatments. That is, some studies involved more than one treatment approach. By a factor of about 3, the most common treatment was cognitive behavior therapy, or CBT. The other treatments were interpersonal therapy, supportive counselling, and other, which is just a bunch of miscellaneous treatments. In most cases, the psychological treatment was compared to treatment as usual as the control condition. In the remaining, it was compared to a waitlist group or other. The results showed that mums who completed psychological treatment reported lower levels of depression than mums in the control condition. And for stats people, the Hedges G was about 0.7, which is a moderate to large effect size. And these benefits were still evident, albeit to a lesser extent, 1 year after treatment. There was no evidence that the benefit of psychological treatment depended upon the period in which mum experienced depression. That is, during pregnancy versus after childbirth. And there's also no evidence that it depended upon the type of treatment that mum received. There was some suggestion that mums who were diagnosed with depression benefited more from treatment than mums who were not diagnosed with depression, but who reported high levels of depressive symptoms. And one way of thinking about this is that mums with more severe depression tended to benefit to a greater extent than mums with less severe depression. So, in conclusion, it looks like psychological treatments are effective in reducing depressive symptoms that occur during the perinatal period. As mentioned, I'm going to give a brief introduction to one such treatment, CBT. So there are a couple of reasons why I'm focusing on CBT for perinatal depression rather than the other types of treatment. First, excluding the other treatment category considered by Kuipers, which was a hodgepodge of different treatment approaches, CBT had the largest effect size, about 1.2 times bigger than interpersonal therapy and supportive counselling. Though while CBT had the largest effect size, to be clear, there was no statistical evidence of any difference between treatment types. So I won't push this point too hard. Second, about 3 times more studies have investigated the effectiveness of CBT for perinatal depression than any other type of treatment approach. Consequently, we can be more confident in the estimate of CBT's effectiveness relative to the estimates of the effectiveness of other interventions. Third, CBT is identified as a treatment for perinatal depression in the National Institute of Clinical Excellence, NICE, guidelines. And lastly, it seems reasonable that the effectiveness of CBT for perinatal depression should be considered in light of what we know about CBT for depression more generally. And what we know is that there's robust evidence demonstrating the effectiveness of CBT in reducing depressive symptoms, which is why CBT is recommended as a first-line treatment for depression. Thus, with those points in mind, in the following, I'll try to give you an idea what CBT for perinatal depression might look like. If you're not familiar with CBT, you can check out my video in the link below, which provides a more general and slightly more extensive introduction to CBT. So CBT programs for perinatal depression have varied, but not surprisingly, there's been a focus on the relationship between mum and child. So I'm going to illustrate the two key parts of CBT, the cognitive part and the behavioural part, with the mother-child relationship as the focus. So first of all, the cognitive part of CBT. So a key principle in CBT is that while the situations we encounter influence how we feel and behave, the way we perceive or construe those situations also plays a major role in how we feel and behave. A good way to illustrate this idea is in the context of specific phobias, and I'm going to go with needle phobia. So suppose you have two women, Jane and Jill. Now suppose they're both sitting in the waiting room at the doctor's office about to have a needle as part of a prenatal checkup. Jane is highly anxious, fidgety, and constantly checking the clock. Jill, on the other hand, is calm and relaxed. So the situation is exactly the same for both of them, so the situation can't explain the differences in their emotions and behaviour. So if it's not the situation, then what else can explain the differences? The answer, at least according to CBT, is what Jane and Jill are thinking. For example, while Jill may be thinking, it'll be good to get this needle so I can get the results of this test, Jane may instead be thinking, this needle is going to be so painful, it's going to hurt so much, I hate needles. So no wonder Jane is feeling anxious. Anyone who was thinking the same way would feel anxious. So, moral of the story, our thoughts play a major role in how we feel and behave. Now, people who suffer with depression tend to experience distorted thoughts. In the context of a mum who is experiencing perinatal depression, these thoughts might concern the ability to effectively parent. For example, I'm not going to be able to soothe my baby, I'm a bad mum. Second, expectations about how to feel. I should be feeling happier. And third, what other people think of her parenting. For example, when other people see my baby cry, they must think I'm a bad mum. Now, according to the CBT model of depression, these kinds of thoughts are the major reason why people feel depressed. Thus, the cognitive part of CBT focuses on helping people tackle distorted thoughts so that they think about things in a more realistic or objective way, with the idea being that this will help reduce depressive symptoms. Now, to illustrate how you deal with distorted thoughts in CBT, let's suppose you have a mum, Jane, who thinks that I should be interacting with my baby all the time, but I'm not, I must be a bad mum. Now, if Jane had this thought, then fair enough, she's feeling depressed. Any mum who had this thought would be feeling down on themselves. The question, of course, becomes, is the thought true? Now, one thing to briefly mention is that if you're not someone who's prone to feeling depressed, then you might quickly recognize the thought's not true. However, even if you are someone who is feeling depressed, when you hear the thought out loud or you see it written down, you can recognize that it might be on the more extreme side. And I've had plenty of clients have that experience in session. The issue is that sometimes, maybe a lot of the time, when you're feeling depressed and stuck with the thoughts in your head, the truth can be difficult to see, which is where the following might come in handy. So in CBT, what you want mum to do is evaluate the truthfulness, validity, accuracy, veracity, whatever terms works best, of her thoughts. In this case, I'll focus on the first part of the thought, I should be interacting with my baby all the time. Now, people use different analogies concerning how to go about testing the truthfulness of thoughts. For example, being a scientist, a judge, or a detective, and I'll just illustrate with the last one. So Jane is a detective with a job being to look for evidence for and against her thought. Now let's start off with Jane trying to uncover evidence for her thought. And maybe she comes up with, everyone says that it's really important to interact with your baby. And interacting with your baby helps them develop. Now that will do for the moment. Maybe Jane would come up with other things. At any rate, you then get Jane to shift to consider the evidence against her thought. And in this case, maybe she comes up with, it's unrealistic to think I can interact with my baby all the time. Plenty of mums have time away from their baby and their kids are just fine. If I were interacting with my baby all the time, I would not have time to do everything else that needs to be done, and this would make me feel depressed. It's important to take time for myself because this helps me feel better, which is good for me and my baby, because when we're together, I've got more of myself to give. Now, after collecting the evidence for and against the thought, Jane then needs to revisit her original thought. That is, considering this evidence, how likely is it that the thought is true? Now, if it's not very likely to be true, what would be a more realistic way of thinking about interacting with your baby? In Jane's case, hopefully you'd end up with something like, it's probably good if I interact with my baby as much as I can, but I need to make sure I don't do this at the expense of my own mental health. And if there are times when I'm not interacting with my baby, they're going to be okay. The idea is that if you had this more balanced thought, you probably wouldn't be feeling as bad as if you had the original thought. Now, the cognitive part of CBT can be a tricky process, even for trained CBT clinicians. And there's more to it than I've outlined in this brief example. But while it does take some practice, in my experience, anyone can get the hang of evaluating their thoughts. So now onto the behavioural part of CBT. So one of the hallmarks of depression is behavioural inactivity or withdrawal. Now this might arise because of feelings of tiredness, low motivation, a loss of pleasure, or difficulties with decision making. This behavioural inactivity or withdrawal can contribute to depression, forming a vicious cycle as shown here. Now for example, Jane may find that she's feeling depressed and so spends most of her time at home with baby. This leads her to think that she's a failure, for example, for not doing more with baby, which in turn contributes to depression. So a key behavioural part of CBT for depression is behavioural activation, that is, getting out there and doing stuff. And there are a few reasons why behavioural activation is helpful. First, it can be a distraction from depressive thoughts. Second, depression may worsen feelings of tiredness and fatigue, which naturally come along with being a parent or having a newborn baby. Now, while people may want to rest up, this can result in more intense feelings of tiredness and fatigue. So doing the opposite, that is being behaviourally active, can combat depression-related feelings of tiredness and fatigue. And finally, while you can, in principle, feel good about yourself in the absence of action, many people will judge themselves on their actions, or lack thereof. Becoming more behaviourally active gives you a solid base upon which you can think more positively about yourself. So in terms of behavioural activation for depression, it's common to lump behaviours into two categories: stuff that's fun and stuff that gives you a sense of achievement. Specifically, often when people are depressed, they've stopped doing fun, pleasurable, enjoyable things. And so it's good to start doing these kinds of activities again. Also, when people are depressed, they experience feelings of worthlessness or lack of purpose, hence doing activities that can give you a sense of achievement. Now, it's not easy to get started with behavioural activation, so it's usually suggested that you start simple and start small, working your way out from there. And in my experience, nothing is too small. As long as it's more than what you've been doing, that's a start. Another difficulty people often have is coming up with activities to do. The following link provides access to a self-help workbook with 365 activities that you could potentially try. Now, this list was not specifically designed for perinatal depression, and so coming up with activities that involve mum and baby is probably going to be a good thing to think about. For example, for Jane, one behavioural activation strategy might be to simply go for a walk with baby in a pram to the end of the street and back. Now, it doesn't have to be big. Anything more than what you've been doing is a win. So that's it for CBT for perinatal depression. If there's anything I've gotten wrong, any research I've overlooked, or if you have any questions, then feel free to get in touch. Otherwise, happy parenting.